Seniors, 10 early signs of dementia you should never ignore. Dementia is not a single disease, but rather a group of conditions that affect memory, reasoning, and social abilities. It is important to emphasize that in the early stages, dementia affects daily life but does not completely destroy these functions. That is why recognizing the first signs is essential to ensure proper treatment and family support. Many people believe that memory loss is just a natural part of aging. This dangerous misconception prevents millions from seeking help when medical interventions could make a real difference. Early detection makes it possible to slow the progression of the disease and preserve quality of life. Today on Your Health, we are going to talk about 10 warning signs you should never ignore. Think about the people close to you. Have you already noticed any of these changes? If so, let's move on to the first sign. Early sign of dementia. Number 1. Memory problems. Memory problems are often the first sign noticed when dementia begins to manifest. However, it is essential to understand that not every lapse of memory is necessarily concerning. There is a clear difference between the common forgetfulness associated with normal aging and the memory loss linked to conditions such as Alzheimer's disease and other forms of dementia. In the natural process of aging, it is normal to occasionally forget where you left your keys or to struggle momentarily to recall someone's name during a conversation. These lapses, while frustrating, do not significantly compromise independence or daily life. In dementia, however, forgetfulness is persistent, frequent, and directly impacts routine activities. One of the most noticeable features is difficulty retaining recent information. People in the early stages of the disease often forget conversations that just took place, fail to remember meals from a few hours earlier, or miss important appointments even after writing them down. It is also common for them to repeat the same questions several times in short intervals, showing an inability to retain new information. Meanwhile, long-term memories such as events from youth or earlier life experiences remain relatively intact. This creates a confusing situation for both the individual and their loved ones. How can someone recall distant events in detail, yet fail to remember what they just heard? This contrast is often distressing. Many individuals realize something is wrong and out of shame begin to avoid social situations. To compensate, they may rely on notes, calendars, or repeatedly ask others to repeat information. Family members, for their part, tend to notice these changes in daily life. It is common for a parent or grandparent to begin repeating stories, forgetting birthdays, confusing important dates, or having trouble with familiar tasks such as preparing a well-known recipe. The progression of this symptom varies. In some cases, it advances slowly. In others, it evolves more quickly. Regardless of the pace, when memory lapses begin to compromise independence, seeking medical evaluation is essential. Healthcare professionals may conduct cognitive tests, review medical history, and, if necessary, order brain imaging exams. Even if dementia is not confirmed, early evaluation can help identify other treatable causes and allow for planning appropriate care strategies for the future. Early sign of dementia. Number 2. Changes in mood and behavior. Changes in mood and behavior are among the most challenging signs of dementia, as they deeply affect not only the person diagnosed, but also the entire family and social circle. In the beginning, they may be subtle and easily mistaken for stress, fatigue, or even shifts in personality. However, over time they become increasingly evident and impact social relationships, family life, and overall quality of life. It is important to understand that these changes are not caused by laziness, lack of willpower, or stubbornness. They are a direct consequence of the chemical and structural changes in the brain that accompany the progression of dementia. In other words, they are symptoms of the disease, not conscious choices. One of the earliest emotional signs is often depression. The person may experience frequent sadness, lack of motivation, or loss of interest in activities that were once enjoyable. In many cases, this depressive state appears months or even years before memory problems become noticeable. Anxiety is also very common, manifesting as excessive worry, constant nervousness, or fear without a clear cause. Behavioral changes often include irritability and agitation. Someone who was once patient may become explosive in response to small frustrations. On the other hand, apathy may also emerge when the person simply loses interest in hobbies, social interactions, and even family moments. Another striking symptom is paranoia. The person may unjustly mistrust others, believe that things are being hidden from them, or even think they are being deceived. This loss of trust can deeply damage family bonds. Sleep disturbances are another aggravating factor. Insomnia or a reverse sleep cycle are are common, with nights spent awake and days spent sleeping. This disruption affects not only the patient but also caregivers, increasing emotional and physical exhaustion for everyone involved. The impact of these changes is enormous. Relatives may feel overwhelmed, guilty, or frustrated. That is why it is essential to seek understanding, patience, and professional support. Medical evaluation helps distinguish whether these signs truly stem from dementia or from other causes, such as side effects of medications or physical illnesses. Treatment may include medication, behavioral therapies, well-structured routines, and organized environments that help reduce anxiety and stabilize mood. In addition, educating the family about these symptoms is crucial to preserving emotional bonds and promoting a more harmonious daily life. Early sign of dementia number 3. Difficulties with visual and spatial perception. Difficulties with visual and spatial perception are among the most complex early signs of dementia because they do not involve only vision problems, but rather how the brain processes and interprets visual information. This means that, unlike conditions such as cataracts or nearsightedness, which affect the eyes, here the challenge lies in how the brain organizes what is seen. One of the first signs is often a loss of depth perception, making simple daily tasks risky, such as climbing stairs, using an elevator, going down steps, or crossing a street. Reading also becomes difficult. The person may skip lines, lose words, or get confused with text they previously understood easily. Even familiar documents may appear strange, disorganized, or hard to interpret. The ability to drive is one of the first to be compromised. Activities that require judging distances, motor coordination, and attention, such as parking, changing lanes, or interpreting traffic signs, become increasingly difficult. Often the person begins to feel unsafe and may even get lost on routes they previously knew well. Another common problem is difficulty distinguishing colors and contrasts. This affects simple tasks, such as choosing appropriate clothing, identifying objects on similar surfaces, or noticing important visual cues in the environment. This limitation considerably increases the risk of household accidents, as obstacles may go unnoticed. In some cases, confusion even occurs with reflections and mirrors. The person may fail to recognize their own reflection, or react as if another person were in the room. This experience often causes fear, discomfort, and loss of self-confidence. Over time, the challenges increase. Difficulties reading maps, finding their way in familiar places, or even completing basic tasks, such as reaching for objects or moving around the house, become more frequent. This raises the risk of falls and accidents, reducing independence. Beyond the physical impacts, there are also emotional consequences. It is common for the person to feel anxiety, frustration, and fear in response to the loss of abilities that were once simple. This insecurity may lead them to avoid leaving the house or to reduce activities. Early diagnosis is essential to distinguish these difficulties from common eye problems. Healthcare professionals may recommend adaptation strategies in the environment, such as improving lighting, using contrasting colors on furniture and stairs, reducing obstacles, and organizing spaces clearly. These measures help preserve safety, autonomy, and quality of life. Early sign of dementia number 4. Difficulty with familiar tasks. One of the most noticeable early signs of dementia appears when a person begins to have trouble with tasks they have performed countless times throughout their life. It is not about learning something new or complex, but about routine, familiar, and automatic activities that suddenly seem strange or confusing. These difficulties are linked to problems in procedural memory and executive functions of the brain, the areas responsible for attention, planning, problem-solving, and sequencing the steps needed to carry out daily activities. When dementia starts to affect these functions, tasks that once felt simple become real challenges. Examples include managing finances, following a recipe that has been cooked for years, using familiar household appliances, or even handling basic functions on a mobile phone or computer. Activities that require integrating several cognitive skills begin to fragment and become progressively harder. At first, the change may be subtle. The person takes longer to complete a task, needs to concentrate excessively, or skips important steps without realizing it. In other situations, they may get lost in the middle of an activity they have done hundreds of times before, such as preparing a meal or paying a bill. As symptoms progress, these problems become more obvious. The person may forget how to use an application they previously mastered, get confused with simple phone functions, or even get lost while driving in familiar places, forgetting traffic rules. Financial errors can also occur, such as paying the same bill twice or misinterpreting a bank statement. Routine household activities such as cooking traditional dishes or doing small repairs may also become overwhelming, not because of physical limitations but due to cognitive difficulties. This loss of autonomy often leads to frustration, anxiety, and mood changes, also affecting family members. It is important to distinguish occasional mistakes from persistent problems. Everyone may forget a step in a recipe or make an error while paying a bill. However, when these lapses become frequent and begin to affect independence, a medical evaluation is essential. Early diagnosis can confirm dementia or reveal other possible causes such as vision or hearing problems, side effects of medications, or emotional issues. This way, appropriate support can be offered, helping preserve quality of life as much as possible. Early sign of dementia. Number 5. Changes in sleep patterns. Changes in sleep patterns are an often underestimated early sign of dementia, but they have a profound impact on physical health, emotional balance, and quality of life, both for the person affected and for their caregivers. Unlike the common sleep changes that may come with aging, here the problem is persistent, intense, and disorganized, significantly disrupting daily functioning. Insomnia is one of the most frequent symptoms. It shows up as difficulty falling asleep, frequent awakenings during the night, or the inability to fall back asleep after waking up. This is not just an occasional bad night of sleep, but a repetitive pattern that leads to constant fatigue, loss of concentration, irritability, and decreased cognitive performance. Another characteristic issue is the reversal of the sleep-wake cycle. The person stays awake at night and sleeps during the day, disrupting not only their own routine but also that of those around them. This phenomenon is known as sundowning syndrome and is usually accompanied by increased agitation, nervousness, and mental confusion in the late afternoon and evening. As the disease progresses, sleep becomes even more fragmented. Intense dreams, excessive movements, frequent awakenings, and episodes of extreme daytime sleepiness may appear. In addition to increasing fatigue, these disturbances raise the risk of falls and household accidents. Several factors influence this condition: brain changes caused by dementia itself, anxiety, depression, medication side effects, or even modifications in the sleeping environment, such as a change of bedroom or bed. The consequences go far beyond poor sleep. Lack of proper rest accelerates cognitive decline, weakens the immune system, and raises the risk of associated illnesses. For caregivers, disrupted nights mean greater physical and emotional strain. Some measures can help: keeping regular sleep schedules, reducing light stimuli in the evening, creating a calm and comfortable environment, and encouraging light activities during the day. In persistent cases, doctors may recommend therapies or medication, always with caution. Ensuring more peaceful nights is essential not only for the patient but also for everyone involved in the caregiving journey. If you found this content useful, click like, subscribe to the Your Health channel, and share this video with your loved ones. Also, turn on the notification bell to get our next health and wellness tips as soon as they are released. Early sign of dementia. Number 6. Language problems. Language difficulties are one of the most common early signs of dementia and can appear in different ways. They range from trouble finding simple words to more complex problems involving comprehension, reading, and writing. It is important to understand that this is not just about occasionally forgetting a name or a word, something that can happen to anyone. In dementia, these difficulties are persistent, frequent, and progressive, directly affecting communication and social interaction. One of the first symptoms is called anomia, which is the difficulty of retrieving common words from memory. The person may stop in the middle of a sentence, remain silent for a few seconds while trying to remember a simple word, and often end up replacing the correct term with a vague description. For example, instead of saying pen, they may say, "that thing you write with." This is not just a passing lapse, but a recurring loss of access to familiar words. Another challenge is keeping up with conversations. In the early stages of the disease, the person may easily lose track, repeat questions that have already been answered, or appear confused when the discussion involves multiple topics or different speakers. Busy social environments such as parties or family gatherings become especially difficult and exhausting. Reading comprehension also tends to be affected. People who once enjoyed reading books or newspapers may begin rereading paragraphs several times without understanding the content, or lose track of the story, forgetting characters and recent events. Writing also changes. Sentences become disorganized, spelling mistakes appear in words once well known, and even handwriting may become irregular and hard to read. Repetition is also common. The person may tell the same story several times or repeat questions without realizing it. These communication difficulties often cause frustration, anxiety, and even social withdrawal. Many individuals recognize their limitations and prefer to avoid interactions so as not to feel embarrassed. However, effective strategies exist: speaking slowly, using short and clear sentences, allowing time for a response, and never interrupting the person. In addition, working with speech therapists can provide techniques and exercises exercises that help keep communication active. If language problems begin to interfere with daily life, it is essential to seek medical evaluation, as these symptoms may point to dementia or other conditions that also affect speech and comprehension. Early sign of dementia number 7. Impaired judgment. Changes in judgment and decision-making ability are among the most difficult early signs of dementia to detect, especially for close relatives. It is natural for everyone to make occasional mistakes, but in dementia, these mistakes are not isolated. They reflect a deeper change in how the brain evaluates information, recognizes risks, and makes everyday decisions. One of the first areas where this becomes evident is finances. The person may make unnecessary and expensive purchases, spend beyond their means, or fall for simple scams they would once have recognized easily. In other cases, they may give away excessive amounts of money, jeopardizing their stability, or take the opposite approach, developing exaggerated distrust of banks and legitimate institutions. Personal safety is also at risk. It is common to forget to lock doors, insist on driving when no longer able, or suddenly refuse to drive due to unjustified fear. Self-care declines, baths are skipped, inappropriate clothing is chosen for certain occasions, and important medical symptoms may be ignored. In social situations, impaired judgment can lead to embarrassing moments. The person may overshare personal information, make inappropriate comments, or fail to respect boundaries in conversations and interactions. Health-related decisions also become less reliable. They may refuse treatments, forget medications, or downplay concerning symptoms. For family members, coping with these changes is challenging, as they face the dilemma of preserving the person's autonomy while intervening to protect them. The best approach is to act with empathy and understanding, remembering that these behaviors are symptoms of the disease, not conscious choices. Early diagnosis is essential to distinguish dementia from other conditions such as depression or medication side effects. Once dementia is suspected and confirmed, it is crucial to begin legal and financial planning as soon as possible, ensuring that the person can still participate in decisions and that their interests are respected. Recognizing these changes is a vital step in protecting safety, dignity, and preparing the family for the challenges ahead. Early sign of dementia number 8. Losing or placing objects in unusual locations. Misplacing objects occasionally is normal, but with dementia, this behavior becomes frequent, illogical, and difficult to correct. A person may put items in inappropriate places, milk in a cupboard, keys in the freezer, documents inside random books, and then be unable to retrace their steps to find them. This often leads to unjust accusations. Someone took my things, which can increase family conflicts. At first, these mistakes may seem minor, such as storing pots on the wrong shelf, but as the disease progresses, objects may end up in completely unusual places. Clothes in the kitchen, food in a drawer meant for papers. The consequences can be serious when what goes missing are medications, important documents, or sharp objects. The emotional impact is significant. Frustration, anxiety, and embarrassment are common. To help, it is useful to simplify and organize the home, reduce the number of items, label cupboards, establish fixed places for keys, glasses, and medications, and use tracking devices while the person is still able to handle them. Occupational therapists can suggest practical adaptations. The most important thing is to respond with empathy, avoiding criticism that increases insecurity. If misplacing items becomes frequent and starts interfering with daily life, a medical evaluation is essential to determine whether dementia or another cause is involved. Early sign of dementia number 9. Withdrawal from social activities. Withdrawing from social activities is one of the most visible early signs of dementia, although it is often mistaken for common factors such as natural aging, fatigue, or simply a personal preference for more quiet time. However, when this isolation happens persistently and progressively, it may signal a deeper cognitive decline. This behavior should not be interpreted as merely choosing to stay home occasionally. It is a gradual and consistent withdrawal from interactions that were once valued and enjoyable. The person may begin missing appointments, making excuses to avoid gatherings, refusing family events, or even abandoning hobbies and leisure activities that were always part of their routine. Often, this isolation is linked to memory and language difficulties. The fear of making mistakes, forgetting names, repeating questions, or being unable to follow a conversation leads the person to avoid social situations. The fear of embarrassment or being judged becomes a barrier to interaction. In addition, factors such as anxiety, depression, and behavioral changes typical of dementia reinforce this pattern. The result is a dangerous cycle. The more the person isolates themselves, the greater the risk of loneliness, and loneliness, in turn, accelerates both cognitive and physical decline. The impact on family is also significant. Moments once filled with joy and connection are replaced by absence, silence, and distance. Often, relatives misinterpret this withdrawal as disinterest or lack of effort, not realizing it is a symptom of the disease. Early intervention can make a big difference. Encouraging social activities adapts adapted to the person's reality, such as light walks, small family gatherings, or simple games, helps keep the mind active and self-esteem strong. It is equally important to respect their limits, without forcing participation in situations that cause discomfort. Healthcare professionals may recommend support groups or activities specifically designed for people with cognitive impairment, offering a safe, non-judgmental environment. Maintaining social connections not only improves emotional well-being, but can also slow the progression of dementia, ensuring more dignity and autonomy in daily life. Early sign of dementia number 10. Disorientation in time and space. Disorientation in relation to time and space is one of the most concerning signs of dementia, and it usually begins subtly before becoming more noticeable. It is important to understand that this goes beyond occasionally forgetting what day of the week it is, or losing track of time while engaged in an activity. It is a persistent and growing confusion that affects both the perception of time and the ability to navigate familiar environments. Regarding time, the person may struggle to understand dates, seasons, or even the passing of hours. They may believe it is morning when it is actually evening, or confuse winter with summer. They may also lose track of the sequence of events, unable to distinguish what happened yesterday, last week, or several months ago. This type of confusion makes it very difficult to plan activities, schedule appointments, or understand instructions such as later or next week. Spatial disorientation is just as striking. At first, a person may get lost in new places such as a supermarket or restaurant. But as the disease progresses, this can occur even in familiar environments such as their own home. It is common to forget the layout of rooms, fail to follow simple directions, get confused with maps, or even be unable to use navigation systems like GPS. Another concerning aspect is how this disorientation affects daily routines. The person may, for example, wear clothes inappropriate for the season, not out of stubbornness, but because they genuinely do not understand the context. They may also become disoriented during short trips, increasing the risk of getting lost even in familiar areas. These difficulties not only affect independence, but also pose safety risks. They may forget the stove is on, miss important appointments, or even put themselves in danger by getting lost in crowded places. Family members are often the first to notice these signs, especially when the person starts confusing dates, appointments, or everyday routes. In the early stages, electronic reminders, calendars, and organized routines may help manage these challenges. However, as symptoms worsen, constant supervision may become necessary to ensure safety. Disorientation in time and space also has a major emotional impact. Many people experience fear, anxiety, and even depression as they realize they are losing control of their perception of the world. That is why early medical evaluation is essential, not only to confirm whether dementia is the cause, but also to provide strategies for safety, routine adaptation, and preserving independence for as long as possible. If you found this content useful, leave a like, share it with someone who could benefit from this information, and subscribe to the Your Health channel to follow more videos with important health and wellness tips. Remember, recognizing the signs early can make all the difference. The sooner dementia is identified, the greater the chances of receiving proper care, adopting treatment strategies, and preserving quality of life. Also, turn on the notification bell on the Your Health channel so you never miss an update.